What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my anatomy playlist. In this video, we'll talk about the pharynx, which looks like a tube. Behind your nose, you have the nasopharynx. Behind the mouth, there is the oropharynx. And behind the larynx, you have the laryngopharynx. If you follow the larynx downwards, you become the trachea or the trachea. But if you follow the pharynx downwards, you become the esophagus. And to many students, this is a tough pill to swallow, no pun intended. Click the like button, click the subscribe button, and let's get started. This is my anatomy playlist. You can find a video on each anatomy region. So I got head and neck, I got thorax, I got abdomen, I got pelvis, perineum, upper extremities, lower extremities, neuroanatomy, and embryology. So this is the skull forming the head. Underneath that, you find the neck. All of this fancy schmancy area is your neck. This bone above is the mandible. This is the base of the skull, particularly the basilar part of the occipital bone. This is the sternum, or the manubrium sterni, and this is the clavicle, this is the scapula. What was the name of the cranial nerve that emerged between the styloid process and the mastoid process? Let's start with the basic non-negotiables. All of this is your pharynx. Behind your nose, it's called nasopharynx. Behind your mouth, it's called oropharynx. Behind your larynx, it's called laryngopharynx. If you continue down the pharynx, you find the esophagus. But down the larynx, you find the trachea. The trachea starts at the cricoid cartilage, and the cricoid cartilage is part of the larynx. But back to the pharynx. The pharynx has three parts: nasopharynx, oropharynx, laryngopharynx. It has three constrictors: superior pharyngeal constrictor, middle pharyngeal constrictor, and inferior pharyngeal constrictor muscle. As for the larynx, everything here is two. You have two major cartilages and two minor cartilages. The two major cartilages are the thyroid cartilage and the cricoid cartilage. The two minor cartilages are: above the thyroid, you find the epiglottis. Above the cricoid, you find the arytenoid cartilage. So the arytenoid cartilages will sit about here, above the cricoid. One on the left, one on the right. Between the left arytenoid and the right arytenoid, there is a muscle known as the arytenoides. If you wish to see more videos like this in the future, drop a heart emoji in the comments. Today's video is just a sample of the longer review on the anatomy of the head and my other videos on the anatomy of the neck review. You can find all of my review videos in a glorious playlist titled A 90 Minutes Quick Review, where you will find review videos for the anatomy of the head, review videos for the anatomy of the neck, review videos for the anatomy of the thorax, the abdomen, the pelvis and perineum, upper extremities, lower extremities, embryology, and neuroanatomy. Each one of these regions is reviewed in 3 videos. Part 1 is titled Quick Review, Part 2 is Ultimate Review, and Part 3 is Clinically Oriented Anatomy of that region. So there is Quick Review for the anatomy of the thorax, Ultimate Review of the anatomy of the thorax, and Clinically Oriented Anatomy of the thorax. If you can just watch these videos, you will know more anatomy than the vast majority of people who live on this planet. But wait, there is more. I have review videos for physiology, review videos for biochemistry, for molecular biology, genetics, pharmacology, pathology. And I cannot forget microbiology. There is a review video for general micro on the gram-positive bacteria, the gram-negative bacteria, the viruses, the fungi, and human parasitology. And I have review videos for internal medicine, 2 review videos for cardiology, 2 on neurology, 2 on pulmonology, endocrinology, hematology, oncology, immunology, rheumatology, nephrology, GI, dermatology, ophthalmology, ENT, infectious diseases, geriatrics, and EKG. And a review video for emergency medicine. If you want me to make review videos on these topics, please let me know in the comments. You'll find several review videos for surgery, as well as pediatrics and obstetrics and gynecology. All of them are in my playlist titled A 90 Minutes Quick Review. And back to the video. You can learn more about the anatomy of the head and neck here. Here is an outline of all of the topics covered in my review videos on the anatomy of the head and on the anatomy of the neck. We do this every time because repetition is the mother of pedagogy. The apex of the heart is formed by the left ventricle. The left ventricle has oxygenated blood. The left ventricle has a cavity and it has an outflow tract. The outflow tract is going to lead you to the aorta. Ascending aorta, aortic arch, descending thoracic aorta, pierce the diaphragm, or more accurately, pass behind the diaphragm at the level of T12 to enter into the abdomen and become the abdominal aorta by a verbal sleight of hand. The ascending aorta has a sinus, and this sinus will give me right coronary artery and left coronary artery. That's the ascending aorta. Then the aortic arch will give me brachiocephalic artery, left common carotid artery, left subclavian artery. There you go. This is the ascending aorta, right coronary artery and left coronary artery. The left coronary artery will then divide into left anterior descending and left circumflex. But I digress. Back to the aortic arch. It has the brachiocephalic artery, it has the left common carotid and the left subclavian. The brachiocephalic artery itself will divide into right subclavian and right common carotid. This is the right vagus nerve. This is the left vagus nerve. The right vagus nerve, which is cranial nerve number 10, after descending that much, it forgot something. Oh, I forgot to give the recurrent laryngeal nerve. So we'll give the recurrent laryngeal nerve, which will loop around and below the right subclavian on the right side. But the left vagus is different. It also forgot the recurrent laryngeal, and then it remembered to give the recurrent laryngeal that will arch below the aortic arch, just near the ligamentum arteriosum, formerly ductus arteriosus. A ductus arteriosus is a duct between two arteries, the aorta and the pulmonary trunk. Here's the aortic arch, brachiocephalic artery, left common carotid, left subclavian. Brachiocephalic will then give me right subclavian and right common carotid. Right common carotid will become external carotid and internal carotid. That's on the right side. On the left side, the left common carotid will also divide into left internal carotid and left external carotid. The internal carotids are for the brain, the external carotids are for the face, basically. At the bifurcation of the common carotid into external and internal, we see the carotid sinus. Carotid sinus contains baroreceptors. The carotid body contains chemoreceptors. Both the baroreceptors and the chemoreceptors in the carotid sinus are supplied by the glossopharyngeal nerve, which is the 9th cranial nerve. However, the chemoreceptors and baroreceptors in the aortic arch are supplied by vagus, because the vagus nerve comes close to the aortic arch before it remembers to give its recurrent laryngeal nerve. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. If you want me to personally tutor you, reach out to me on my website. This is the brachiocephalic artery. This is right subclavian. This is right common carotid. The right common carotid will give me right internal carotid for the brain and right external carotid for the face. The internal carotid has 5 branches. The 2 most important ones are anterior cerebral and middle cerebral. The external carotid artery has 8 branches. I just want you to remember 2 for now. 1 internal, 1 external. The internal one is the deeper one. That's the maxillary artery. The more superficial one is the facial artery. This is the facial artery. From the subclavian artery, we see this vertebral artery. You see it passes through the foramina transversarium of C6, C5, C4, C3, C2, and C1, but it does not pass through C7's transverse foramen. The anterior circulation of the brain is supplied by the internal carotid, whereas the posterior circulation of the brain is supplied by the vertebral artery. 2 vertebral arteries join forces to give me this basilar artery. The basilar artery has many branches. The final ones are posterior cerebral arteries. So now you know where the anterior cerebral, middle cerebral, and posterior cerebral came from. ACA and MCA from the internal carotid, PCA from the basilar, which came from the vertebral. Why do we call the basilar artery basilar? Because it runs on the basis pontis, or the base of the pons. Also because it's located at the base of the brain. Now let's talk about the pharynx. Everything about your pharynx is 3. It has 3 parts, which is nasopharynx, oropharynx, and laryngopharynx, and it has 3 constrictor muscles: superior pharyngeal constrictor, middle pharyngeal constrictor, and inferior pharyngeal constrictor. There you go. Nasopharynx behind the nose, oropharynx behind the oral cavity, laryngopharynx behind the larynx. All of this is your pharynx. It's continuous with the esophagus. The pharynx has 3 constrictors: superior pharyngeal constrictor, middle pharyngeal constrictor, and inferior pharyngeal constrictor. I've told you that everything about the pharynx is three. It has three parts: nasopharynx, oropharynx, laryngopharynx. It has three constrictor muscles: superior, middle, and inferior pharyngeal constrictors. And it has three other muscles, and these are stylopharyngeus, palatopharyngeus, and salpingopharyngeus. What's the name of the doozy nerve that supplies all of them? Well, it's not one nerve, it's a plexus of nerves. We call this the pharyngeal plexus of nerves, which is formed by glossopharyngeal nerve, vagus nerve, and superior cervical sympathetic ganglion. The pharynx itself is a muscular tube. And of course, the tube is lined by mucous membrane and covered with deep fascia on the outer surface and on the inner surface. So we call it the investing deep fascia of the pharynx. This is the superior pharyngeal constrictor, this is the middle pharyngeal constrictor, and this is the inferior pharyngeal constrictor. As for the three other muscles, we can see stylopharyngeus from here. There is a ligament here called the pterygomandibular ligament, which extends from the pterygoid hamulus to the mandible. The superior constrictor muscle starts at the pterygomandibular ligament, or the pterygomandibular raphe. As for the middle pharyngeal constrictor, it starts at the stylohyoid ligament and the two horns of the hyoid bone, and then it fans backwards. The inferior pharyngeal constrictor starts from this line, which extends between thyroid cartilage and the cricoid cartilage. Where do all of these constrictor muscles insert? They form a raphe in the midline, called the median raphe, which extends from the base of the skull to the cricoid cartilage. Wow, that's a long raphe. Next, the three other muscles: stylopharyngeus muscle from the styloid process to the lamina of the thyroid cartilage. The stylopharyngeus muscle is supplied by the glossopharyngeal nerve. Action: stylopharyngeus muscle can elevate the thyroid cartilage. Or you can say it elevates the pharynx and the larynx during deglutition. Next, palatopharyngeus muscle starts from the palatine aponeurosis of the soft palate and inserts into the lamina of the thyroid cartilage. It is innervated by the pharyngeal plexus of nerves, and its action is very similar to stylopharyngeus muscle. Salpingopharyngeus muscle arises from the Eustachian tube at its lower surface, near its pharyngeal opening, because remember that the Eustachian tube opens in the pharynx, in the nasopharynx to be specific. The insertion of salpingopharyngeus muscle is into the posterior border of the lamina of the thyroid cartilage. Innervation is by the pharyngeal plexus of nerves. The action is similar to the previous two muscles, plus it keeps the Eustachian tube open. What else in the human body is referred to as salpinx? If you say the fallopian tube of the uterus, you're absolutely correct. Good job. And that's what salpingitis means. See, everything about the pharynx is three. Even the pharyngeal plexus of nerves is made by three nerves, which are the glossopharyngeal nerve, the vagus nerve, and the superior cervical sympathetic ganglion. The glossopharyngeal nerve is going to supply the pharynx with somatic motor fibers for the stylopharyngeus muscle and sensory fibers as well. The vagus nerve supplies the pharynx with motor fibers plus parasympathetic fibers. As for the sympathetic cervical ganglion, of course it will supply us just with sympathetic fibers. Quick notes: the stylopharyngeus muscle is supplied by the glossopharyngeal nerve. As for the vagus, it will give us recurrent laryngeal nerve. The recurrent laryngeal nerve of the vagus supplies all of the muscles of the larynx, except cricothyroidus. The recurrent laryngeal nerve also supplies the inferior pharyngeal constrictor, because this is the constrictor that's closer to the larynx. No duh. So if the recurrent laryngeal nerve of the vagus is going to supply the larynx, it makes sense that we'll supply the muscle of the pharynx that is near this thyroid cartilage. And this is the inferior pharyngeal constrictor. Arterial supply of the pharynx. First, ascending pharyngeal artery. Where did that come from? This is one of the branches of the external carotid artery. Second, tonsillar artery. Where did that come from? From the facial artery of the external carotid artery. Third, ascending palatine artery, also a branch of facial, which is a branch of the external carotid artery. Fourth, superior thyroid artery, which is a direct branch of external carotid artery. and inferior thyroid artery, which is not a branch of the external carotid, but instead the inferior thyroid came from the thyrocervical trunk, which came from the first part of subclavian artery. So, superior thyroid is not the same as inferior thyroid. Superior thyroid is a direct branch of external carotid artery, whereas inferior thyroid artery is a branch of the thyrocervical trunk, which is a branch of subclavian. This is the pharynx as seen from behind. This is the base of the skull. These are the choana of the nose, posterior choana or posterior openings of the nose. This is the pterygoid hamulus, which is part of the medial pterygoid plate, and it gives rise to the pterygomandibular ligament. Right here you see the superior pharyngeal constrictor muscle, and then middle and then inferior. After the pharynx we see the esophagus. This is the epiglottis, which lies on top of the thyroid cartilage. This is the entrance to the larynx. So behind the larynx we have the laryngopharynx. This is the back of your tongue. This is the musculus uvulae. This is the palatopharyngeus muscle. This is your external carotid artery supplying the pharynx. Here is your daily reminder that the external carotid artery has 8 branches. It gives us superior thyroid, lingual, and facial arteries from its anterior aspect. It will give us occipital artery, posterior auricular artery, and ascending pharyngeal artery. And then it will give us its 2 terminal branches, maxillary artery and superficial temporal artery. The arteries that are going to supply the pharynx include, of course, the ascending pharyngeal artery, the facial artery, and the superior thyroid artery. Arterial supply of the pharynx. First, ascending pharyngeal artery. Where did that come from? This is one of the branches of the external carotid artery. Second, tonsillar artery. Where did that come from? From the facial artery of the external carotid artery. Third, ascending palatine artery, also a branch of facial, which is a branch of the external carotid artery. Fourth, superior thyroid artery, which is a direct branch of external carotid artery. And inferior thyroid artery, which is not a branch of the external carotid, but instead the inferior thyroid came from the thyrocervical trunk, which came from the first part of subclavian artery. Next is the larynx. This is the mastoid process. This is the sternum, this is the clavicle. This is the sternocleidomastoid. Sternocleidomastoid. Behind me is the trapezius. In front of me there is the midline of the neck. In front of the sternocleidomastoid, this is the anterior triangle of the neck. Behind the sternocleidomastoid, you see the posterior triangle of the neck. Next, what's that bone? This is the hyoid bone. You see this? This is the digastric muscle, anterior belly and posterior belly. How about this one? This is omohyoid. Omo reminds me of the scapula. Hyoid reminds me of the hyoid bone because this muscle attaches to the scapula and it attaches to the hyoid bone. Under the hyoid, there is thyroid cartilage. Under the thyroid, there is cricoid cartilage. Above the thyroid cartilage, we can see the epiglottis hanging out. Above the cricoid, we see 2 arytenoid cartilages. Between the hyoid bone and the thyroid cartilage, there is thyrohyoid membrane. This thyrohyoid membrane will be pierced and penetrated by 3 structures: 1 nerve, 1 artery, and 1 vein. The nerve is the internal laryngeal nerve, which is a branch of the superior laryngeal nerve, which is a branch of the vagus nerve, cranial nerve number 10. The artery is the superior laryngeal artery. The vein is the superior laryngeal vein, because it's a vein above the larynx. This is the larynx. Between the thyroid cartilage and the cricoid cartilage, we see the cricothyroid membrane. The anterior part of that membrane is thickened, forming median cricothyroid ligament. This cricothyroid membrane has a lateral part that forms cricovocal membrane, whose upper free border will become the vocal ligament, also known as the true vocal cord. What is the true vocal cord? The true vocal cord is the vocal ligament covered by mucous membrane. And of course, you have 2 true vocal cords. You can learn more about the larynx in my video titled Anatomy of the Larynx, which you can find in this anatomy playlist. You can learn about all of these topics in my video titled Anatomy of the Neck. Before you leave this video, I want you to sit down, focus, and try to answer the following questions. Where can I find each of these foramina on the skull? And what are the structures that pass through each one of these? Please pause and review. This is very important. After mastering anatomy, you can master surgery by downloading my surgery high yields course at medicosisperfectionalis.com. I help you learn, understand, and pass exams. I have many courses on my website. Each one comes with videos, notes, and cases. If you find these videos to be helpful, please consider supporting my channel by buying me a coffee. Go to buymeacoffee.com/medicosis. There are more than 750 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.